Hi, good morning, everyone. Better health for AI. I'm Geetha, founder and CEO of Niramai Health Analytix. Right. So all of us want to use AI for better health. There's several potential benefits of using AI to make people healthier, happier, and live for a long, long time. We have many applications of AI where it can be used for risk assessment, doing screening and diagnosis, telling the doctors what is the best treatment among the 1,000 different options that are available, mapping the DNA of the person, and several other applications, both clinical and operational in nature. Health applications of AI can also reduce healthcare costs, make it possible for several people who cannot even afford to have high-quality healthcare really happen. It can improve patient experience by reducing waiting times, making it more scalable because repeatable things can be automated, and so on and so forth. And last but not the least, reduce misdiagnosis, missed diagnosis both, enabling doctors to be more accurate because everybody is human. But the best application that I love the most and has been referred to earlier today on this stage is how can we use AI to bridge the healthcare divide that exists between haves and the have-nots, developing and the developing countries, rural and the urban ecosystem. I come from India, where we faced severe issues during COVID because of the huge infrastructure gap that exists between the villages and the cities. The doctors in the cities are extremely busy because they are pounded with patients. They don't have time to have tea. AI can help them by being their assistant, helping them actually do mundane tasks or look at seemingly normal patients and almost be an intern, doing the first level of checking and then giving it to the doctor. In the villages and the rural areas, AI can become the robo-doctor, trying to do the triage of different diseases and bring people to the urban infrastructure at the right time for the right people. As a computer scientist, when I was super interested in this, fate put two instances in front of me. Two of my close friends / family members, Bharti and Lakshmi, got detected with breast cancer. They were 42 years and 38 years of age. Both of them had small sons. It was devastating. Economically, socially, emotionally, the whole family was shattered. The extended family was shocked. They just lived for 6 months after they detected their late-stage breast cancer. That's when I quit my job as the head of AI for Xerox and started Niramai, a small startup in Bangalore, where we started looking at this problem. That's when I realized that 680,000 women die every year because of this disease. 2.2 million cases every year. 1 in 7 women are likely to have a breast abnormality in their lifetime. Mortality rates vary from 16 to 60%. India, 50 to 60% mortality rate, which means that every alternate lady detected with breast cancer is dying. Breast cancer is completely curable. Only thing is early detection. What's stopping us from detecting it early? Several. Affordability, accessibility is always an issue. Lack of awareness. We talked about education. People think only if there is a lump you need to go to the hospital. So, no, sorry. You need to do preventive screening. There's also technology limitation, which enables screening only after 45 years of age. But 27% of all cancer deaths are under 45. To solve this problem, we came up with this new method for detecting breast cancer called Thermalytix. It's a very simple test where we use a device like this. All of you have seen it, the thermal imaging camera, thanks to COVID. The same thermal imaging device is used to measure the temperature variations on the chest. 400,000 temperature points per person. And we use AI and machine learning algorithms to analyze the 400,000 temperature points to say if there is an abnormality, what is the probability that it's actually cancer? And also, where is it? So that the doctors can take real care of the person and do further diagnosis, biopsy, and so on. What you see in the center is an image that the camera gives. It's very, very hard to figure out with human eye that something is wrong and where is it wrong. This is called thermography, which has come into a lot of weather because it's inaccurate when viewed with bare eyes. Now AI comes into the picture, improves the accuracy. The result is a new technique for breast screening, which can detect smallest of the small lumps or lesions which are 4 millimeters in size. It works for women of all age groups and breast densities, less than 45, greater than 45, and even men too, because all we need to do is to keep it like a photography session. Keep it on a tripod, sit in front of it, 3 feet from the person, from the device, and that's it. 8 minutes of blowing cool air, 2 minutes of imaging, and rest the AI will take care of giving you a score or a set of scores which indicate the level of abnormality, the type of vascularity, the type of tissue activity, and so on. No radiation, just measuring temperature. The device costs 1 by 20, the cost of the device that's used for screening today and the most commonly used and recommended. And so many diagnostic centers around the world can actually use it. I brought this in my cabin baggage. It's very portable. So you could take it anywhere to rural areas or even corporate screenings and so on. Last but the best is the experience. The lady sits inside the cabin like this. She closes the door and then removes her clothes. No need to disrobe in front of others. And outside is where the technician sits and gives directions. No touch, no see, no pain, no radiation. As a scientist, I also wanted to make sure that our risks are reduced because it's a high-risk thing that you do pre-screening with this and there could be a problem. So we actually spent a lot of time in the last 7 years publishing and comparing with standard of care. And I encourage you to take a look at niramai.com/publications. We did get all the regulatory clearances, and I'm happy to share that more than 100,000 women have already benefited from this test. It's available in primary care centers, hospitals, and diagnostic centers. We conduct a lot of camps in corporate offices and also rural areas, villages. We have a bus, small bus, which can just have a room inside as well. And to enable disabled people, we actually also have private screening at home. Imagine winning with AI, with thermal imaging, addressing issues like breast cancer and several other types of cancers in this form. Doing it in a completely no touch, no see, no pain, no radiation manner. Working for all age groups, wherever, whenever they need it. And ensuring all the quadruple goals are achieved. Better outcomes, better clinician experience because we give numbers and scores instead of looking at 400,000 color points. Improved patient experience with the wonderful privacy-aware test. And doing all of this at such a low cost and affordable manner that the whole world will benefit. I invite you all to partner with us to take this small solution, which is in 8 countries today, to the whole world and save 2 billion women who need to be screened every year. Thank you.